Greetings, Dr. Brent Bost again for Wise OB. It's March of 2021. It's been a while since we spoke. In November of 2020, I suffered a stroke. Initially, my speech was off a bit, but it's back to normal or pretty close now. My left arm is strengthening every day, and I'm walking with a cane, but hopefully we'll get rid of it soon. The good news is that my cognition has never changed from the stroke, which translated means I'm just as crazy as I've always been. So let's talk today about pregnancy and the coronavirus. The CDC and the American College of OB/GYN have both published guidelines recently, having studied over 100,000 cases of women who are pregnant with COVID. And the good news is that pregnant women with COVID are not at high risk for complications, but they're at increased risk still. So what does this mean in English? Well, it means if you're 30 years old and pregnant and get coronavirus, your risk of dying goes from 1 in a million to 1.5 in a million, which in percentages is 0.00015%, which is not particularly high risk. So similar to the flu, which I come back to, pregnant women are more likely than non-pregnant women of the same age to have respiratory complications and be in an ICU. But the good news is you're not at increased risk for death from COVID if you're pregnant. That's the good news. What should you do? Well, you still need to practice good public health measures, right? Wear your mask when you can, socially distance when possible, work from home if that's something you can do. Those are all smart things, okay? But if your aunt from Cleveland comes and visits and then 2 days later you find out that she had COVID, don't panic, because you're not at high risk from COVID, but you're at increased risk. So watch for symptoms, contact your provider, test as your provider tells you to do. Either that's doctor or nurse midwife. Go along with them, but you should probably get tested about 48 hours after exposure, and quarantine is needed. This makes total sense. What else can you do? Well, you can get vaccinated. As soon as the vaccine is available to you, get vaccinated. Now, the good news is they put 75-year-olds and 65-year-olds and younger people with predisposing conditions ahead of you, which tells you that they don't think you're high risk either. You're just at higher risk when you're pregnant, right? So get vaccinated with your group, whatever that is. And if you do have a predisposing condition, get vaccinated with the group based on that condition, right? Vaccines will not hurt your baby. Let me say that again. The vaccination will not hurt your baby, okay? Very important. There's no mercury or formaldehyde in vaccines anymore. The vaccine manufacturers listened to the crazy anti-vaxxers and took that stuff out so they would take away the arguments against vaccination, right? So that's not in your vaccine. Don't worry about it. There's no live virus in there, so you can't get COVID from it. And it will not alter your DNA. That's not going to happen, okay? It's an RNA fragments that you're getting, not the actual RNA from the virus or DNA for that matter. So it's not going to alter your DNA. Now, it's funny that all the women who are pregnant who've been vaccinated thus far have had blonde, blue-eyed children that looks just like Jessica Alba, but I can't explain that. But it doesn't alter your DNA or your baby's DNA, so don't worry about that, okay? Those are bogus arguments. Get vaccinated, use social distancing, very important. Wait your turn in line and report any symptoms to your doctor or nurse midwife. This is Dr. Brent Bost for Wise OB saying don't panic if you get near COVID, but do respect the disease. Take care of yourself. We'll see you again soon. And until then, TTFN, ta-ta for now.